Welcome everybody. I hope that your summer is starting off great if you're watching us live. If you're watching this as a replay, we are excited that you are joining us. Our mission here at Dr. Solis Educate is to support all nurse educators to achieve excellence, and that includes for some nurse educators passing the certification exam. In the spirit of summertime, we decided to come outside amongst this beautiful weather in California to talk about a really important topic, which is assessment and evaluation. We're continuing to focus on that specific area in our discussions, in our snapshots, in our boot camps as we hone in on competency 3. All right, so this is what we want you to think about. First step is we want you to print out the study worksheet and reflect on what objective is it that you want to achieve at the end of our time together during this snapshot. The second consideration we want you to think about is to pull out Billings and Halstead, 6th edition. Now, if you have the 7th edition, that's great. You're going to find the crosswalk listed right here in the description. And then the third consideration we want you to think about is, what are your next steps to close your knowledge gaps? Okay, so first we're going to go ahead and take a look at the blueprint. In this detailed test blueprint, what you're going to see are some important elements that you want to consider as you move forward on your journey. The self-assessment that you're going to engage in really is related to taking a look at the blueprint. So you're going to go through this blueprint. You're going to do what we call a self-assessment. That includes you exploring each of these topics. And let me make sure I'm sharing the right resource. All right, here we go. This should be the right one. So you're going to go through, do a self-assessment, looking at each of these sub-competency statements just for competency 3, okay, for our time together in this snapshot. We want you to take a look at each of these non-sub-competency statements. We're going to focus on 3B, 3C, 3D, 3G, and 3H, okay? But you're going to look at each one of these statements and do a self-assessment, okay? When we talk about a self-assessment, this is what we mean. We want you to circle, put an asterisk, or highlight any sub-competency statement where you're not at least 70 to 80% confident that you will choose the correct answer on the C&E exam, okay? And then what we want you to do is to go to Billings and Halstead, and we want you to map out content that is going to help you close your knowledge gaps, okay? And we're going to talk about specific chapters in this snapshot. Said there are 2 chapters that we're just going to focus on for our time together in this snapshot. Number 1 is going to be chapter 10, okay, so pages 191 through 200 in the 6th edition, and then table 24.1, which is in chapter 24, okay? You're looking at pages 457 through 471 to help you identify those evaluation strategies and how we can validate that learning has happened with our students. All right, so as you're looking at the thought-provoking question, I know some of you have already had a chance to take a look at it. For those that have not, don't worry. We're going to look at that together as well. The thought-provoking question is exactly that. It's a time for you to explore the knowledge of your knowledge of these concepts. And then we want you to continue to do that self-assessment and looking at your knowledge gap areas. This specific snapshot, we're focusing on what are those specific steps you need to take to transform assessment in nursing education. We want to look beyond points and really talk about what the transformation should look like. Now, I know we have a point-based system, percentages that we look at where we are determining what weight or what percentage of the assessments that we're using will contribute to the overall student's validation of knowledge, okay? So as an example, exams may be, you may require a certain score, students to achieve a certain grade on exams. So 76%, 78%, 80%, okay? So those are points towards that total 1,000 points as an example. But we want to look beyond those points and percentages. We really want to talk about how do we validate that transformation has happened. In nursing education, a transformative assessment strategy is going to help us validate whether or not students have comprehended the concepts and help us validate that students are competent in the specific areas. Okay, so key point number 1, assessment is communication. It gives us information about students, right? It gives us information to state whether or not students are knowledgeable about those concepts. So when we're looking at rubrics, when we are giving students feedback about how they have performed on an assessment. We're communicating with them as to whether or not they have achieved competency and if they have enough knowledge. Billings and Halstead says assessment is most powerful when it is used to promote learning, not just judge it. All right, so I want to say that again. I think that's very powerful. Assessment is most powerful when it's used to promote learning, not only judge it. Students need to understand the why when it comes to the rationale, just like our thought-provoking question. We want you to go deeper, not only to do that surface learning, right? Just like Bloom's taxonomy for cognitive learning domain talks about, that lowest level is remembering or memorizing. We can't stay there. We have to be able to scaffold the learning with our students in a way that they understand the rationale, the why behind the patient care decisions that they are making. All right, so speaking of our thought-provoking question, here we go. So Professor Jones is redesigning the evaluation plan for a high-stakes simulation in a senior level leadership course. She wants to ensure the assessment method captures both the clinical judgment and leadership behaviors demonstrated during the scenario. She considers using a combination of direct observation, student self-reflection, and a structured rubric aligned with course outcomes. Which of the following strategies best reflects evidence-based, competency-aligned evaluation? So we have option A, using a pass-fail checklist to simplify scoring and maintain grading consistency. B, allow students to reflect freely without a structured framework, emphasizing self-awareness over outcomes. Or C, using a rubric aligned with course objectives and that incorporates structured self-reflection for formative feedback. So I'm going to give you a second to think about what the best option is for this thought-provoking question. All right, so point number 2, now that you've had a chance to write down the rationale and your thought about that thought-provoking question, which answer you think is correct and which is incorrect and why. Key point number 2 that you want to consider is that assessment drives equity. It provides consistent and clear defined rubrics related to the actual validation of learning. Okay, that's what an assessment tool does for us. That clarity, that consistency is going to help students know exactly what expectations we have for that assignment. When students know exactly what that criteria is, they are hopefully left not guessing, right? They have a clear understanding, there's less ambiguity, and students are able to include those key elements that we're looking for. Specifically, competency 3, and that should be E, talks about making sure the assessment is a fair, valid, reliable, and culturally appropriate tool. Okay, so it used to be numbers, but it's not numbers anymore. So when we take a look, let's just go ahead and flip to that actual tool. We're going to go back to the blueprint. All right, so when you take a look at that blueprint, this is where you're going to see these details. Okay, so let's go back to the blueprint. All right, so when you take a look at 3G, it talks about applying assessment and evaluation data to enhance the teaching learning process. Also, 3I, okay, to provide timely, constructive, and thoughtful feedback to learners. So what does that look like? Sometimes if we have set the expectation that we respond to students within 48 hours or 72 hours, we may need a little bit more time to actually give meaningful feedback. So what do? We simply communicate with students that even though our goal was to get that feedback to them in 72 hours, we need a little bit more time to give them thoughtful and meaningful feedback. Okay, so we want to communicate with students when we, and then the other piece of communication you want to consider is giving students time to process that feedback. So we give them the feedback, maybe we didn't meet that time frame, and then we want them to have time to really process the feedback that we have given them. And when we're engaging in an exam review, that's an excellent opportunity for students to really have a deeper understanding of the concepts that we have taught them. And if they don't understand those concepts, that's when we want to make sure we are having a conversation, having a discussion about any muddy points that they may have. And most importantly, helping them find that primary content right from the textbook or from the literature that's going to help them close their knowledge gaps. Next, we want to talk about competency-based assessment. This focuses on evaluating students' skills, okay, those psychomotor elements, rather than specific grades, right? Students are able to identify that benchmark that we have described for them, that criteria that we expect them to meet, and then they're able to demonstrate that skill. A skills checklist is an excellent example of a criterion reference document that's often associated with competency-based assessment. This is going to emphasize the importance of active learning, right, through demonstration of those skills, mastery of those skills at a level that we can feel confident that students are able to make those safe patient care practice decisions. We want to integrate learning and engage in holistic evaluation. So we don't want to only use cognitive tools, right? Or we don't only want to validate cognitive learning. We want to make sure that we're emphasizing the connection between theory and practice. That means that we are evaluating psychomotor skills as well as affective skills. And we want to make sure that students are able to apply and integrate these evidence-based practices that we are teaching them about. That's what holistic evaluation is. It also allows us to consider the diverse aspects of our students' performance, knowing that all of our students learn differently, and emphasizing the importance of application and engaging in safe patient care decisions. We want to foster this collaborative environment. We want students to understand that we are their partner on this learning journey. When we look at psychomotor and affective, it's really important that we emphasize these clinical skills in the assessment tools that we're using. It's going to not only validate competence, but also help increase confidence with our students. We want to give this meaningful feedback to our students over a period of time. That's going to include constructive feedback in a way that is formative. So by the time students get to that summative evaluation, they're clear about their knowledge gap areas. We like this quote, so we wanted to share it with you all. Assessment should focus on student development and learning processes, not only the final grades achieved. Now, we know final grades are an important element, okay? So that is quantitative feedback, but we also want to engage in that qualitative feedback. We don't want our students to be surprised when we get to the end of a course that they have not achieved success, right? We're giving them feedback. We're engaging in the learning process as a facilitator. We're partnering with our students to move forward on that learning journey, just like Kolb's experiential learning theory talks about. All right, so what was your choice? All right, as you think about this thought-provoking question, and how are you feeling about these concepts? Do you feel like you're lost and it's a little bit of alphabet soup? You're not sure exactly which area we were talking about. Again, you're going to go back to those page numbers and chapters that we talked about. You're going to look at table 24.1 as well as chapter 10. But go ahead and do a self-assessment. If you feel lost, you're giving yourself a 1. If you're feeling like you're ready to teach and feeling pretty confident, go ahead and give yourself a 5. And then the correct answer was C. All right, so we want you to celebrate if you chose C. And the reason why is because we want to combine a rubric aligned with course outcomes and structured self-reflection. That's going to help ensure that evaluation is going to capture those complex competencies, including clinical reasoning, decision-making, and leadership behavior. So all of these elements we know help support the triangulation of data where we're able to validate learning has happened from a qualitative, quantitative perspective, and students to do that self-assessment as we're engaging in helping them close the loop through formative assessments and ultimately summative assessments as well. So what are your next steps? We want you to take some time to hopefully get outside and to pause and reflect on what your next steps are going to be to ensure that you're integrating these evidence-based practices that we have talked about. We hope that this snapshot has been helpful as you reflect on that thought-provoking question. We want you to make sure you're focusing on the rationale, using the page numbers that we talked about, making sure you're closing your knowledge gaps to achieve either that passing score on a C&E, to renew your C&E, or to become a better nurse educator. Reach out to us. DrSellerseducate.com is where you can find all of our resources. You can find out when the next C&E in 60 days is coming up, as well as our monthly boot camp. And we look forward to seeing you in our next snapshot. Have a great one, everybody. And make sure you get outside to enjoy the sunshine.